bringing light back on the fovea, removal of subfoveal plaque. The authors have no financial interest in any of the products shown in the video. A 65-year-old lady with history of diabetes presented with chief complaints of dimness of vision in both eyes for the last 2 years. On examination, her best corrected visual acuity was finger counting close to face in the right eye and 6 by 36 in the left eye. Fundus examination showed severe NPDR with exudative maculopathy in both eyes with extensive plaque-like subfoveal deposition in the right eye. Literature showed favorable outcomes with surgical plaque removal. However, my mind also said,
No, Lee. Tangerine, do not touch.
now I was confused between literature and difficulties of subfoveal surgery. While I was considering all risks and benefits, I came across this wonderful clip and decided to operate.
Tell us more.
Well, it's something that up to now has been written off as untreatable, but I don't believe it has to be. No one has had the courage to attempt a surgical solution to this.
Well, maybe with good reason.
To put it mildly, Helen, you can't operate on the heart. That's basic.
We don't have clinical proof of that.
That is my point exactly.
Posterior vitreous detachment was induced after core vitrectomy. Vitrectomy was completed with base dissection. Retinotomy was made at 2 disc diameters away from the center of fovea. Localized retinal detachment was induced using balanced salt solution. The first attempt at extraction of the subfoveal plaque was not very satisfactory. On second attempt, however, entire plaque came out en masse using max grip forceps. Plaque removal was completed by cutter. Fluid air exchange was performed to settle the detached retina. Endo laser was applied. Silicone oil of 5000 centistoke was used for tamponade. The extensive subfoveal hard exudates present in the preoperative period showed complete resolution after surgery with few perifoveal hard exudates. The large dome-shaped elevation of subfoveal hard exudates on OCT showed near total resolution with flattening of fovea in the postoperative OCT. BCVA showed marked improvement from finger counting close to face to 6 by 60.
How does that make you feel?
Good. Very good, doctor.